Hospital evacuation planning and patient movement is the central focus of this lesson. This session provides a comprehensive look at the strategies required to manage a hospital environment during critical fire emergencies. We will examine the structural requirements for planning, the specific methods for moving vulnerable patients, and the organizational frameworks that ensure every individual is accounted for. Establishing a robust evacuation plan is not merely a regulatory requirement, but a fundamental component of healthcare safety. Throughout this presentation, we will break down the essential elements of preparedness, from identifying exit routes to executing complex patient transfers under pressure, ensuring that healthcare facilities remain safe havens even during a crisis. Importance of evacuation planning begins with prepared emergency response, which ensures that hospitals are ready to respond quickly and decisively during a fire emergency. This readiness minimizes delays that could lead to injury. Protection of patients and staff is the next critical element, as proper planning helps protect the lives of patients, healthcare workers, and all visitors within the facility. Finally, reducing panic and confusion is a primary goal. Clear evacuation procedures help prevent chaotic behavior and maintain order during high-stress emergencies. By establishing these protocols in advance, the hospital creates a structured environment where everyone knows their specific role, significantly increasing the likelihood of a successful and safe outcome for all occupants. Evacuation routes and emergency exits must be managed with precision. Clearly marked routes are essential, meaning evacuation paths should be clearly marked with visible signs that can be seen even in low light or smoky conditions. Accessible emergency exits are a non-negotiable requirement. These exits must remain unlocked from the inside and easily accessible at all times to prevent entrapment. Additionally, unobstructed pathways are vital for safety, as hallways and exit routes should always be kept clear of obstacles, like carts or equipment. Regular inspections are necessary to ensure that these paths remain wide enough for beds and wheelchairs, ensuring that the physical environment of the hospital supports a rapid exit during a fire. Patient movement during emergencies requires specialized techniques. Priority for critical patients is the first rule, meaning patients who cannot move independently or those on life support require immediate specialized assistance to evacuate. Use of wheelchairs and stretchers is the standard protocol for transport. Staff should use proper equipment to safely move patients without causing further injury. This requires that equipment is distributed throughout the wards. Coordinated staff effort is the final piece of the puzzle, as healthcare workers must work together in synchronized teams to ensure safe patient evacuation. Communication is key here to ensure that no patient is left behind and that the most vulnerable individuals receive help first. Horizontal and vertical evacuation represent the two primary movement strategies. Horizontal evacuation involves moving patients to a safe area on the same floor, typically behind fire-rated smoke barriers, to get them away from the immediate fire zone. Vertical evacuation is a more intensive process, moving patients to lower floors or completely outside the building when the fire threat cannot be contained on a single level. Safe decision-making is required by the leadership on the floor. Staff must decide the safest evacuation method depending on the specific situation and the speed of the fire spread. Understanding the building's fire compartments is essential for staff to make these life-saving decisions correctly under pressure. Assembly areas and accountability are the final steps in the evacuation process. Designated assembly points are safe areas outside the hospital that should be assigned for evacuation to ensure everyone gathers in a known location. Headcount procedures must be implemented immediately upon arrival at these points. Staff should account for all patients, visitors, and employees using updated rosters. Emergency coordination is the overarching necessity, where proper communication with Incident Command ensures everyone is safely accounted for. This structured approach to accountability allows emergency responders to focus on fire suppression rather than searching for individuals who might already be safe, ensuring a controlled conclusion to the emergency event.